like an egg beater, but this is the bigger one. This is not, we don't have the, so it's flat. Usually it comes flat. And then we crank it open when it's inside the breast. And then it gets to be bigger, but we have to fill the space.
This space inside will be filled with what? With?
It's empty.
It's empty, okay.
Yeah, so basically, this whole thing, well, it'll click. This is kind of the bigger one, but it'll click once it's, there we go.
Oh.
And then, so this part would be inside your breast, and then this is just kind of hanging out, but we push it, you know, we bandage it up and we dress it and all that.
Okay.
So really, the only thing that's outside the breast is this tail.
Okay.
And then everything else is inside. But you have to have a space big enough to fit.
And that's the part Dr. Lou said they can make it bigger. She will be able to make it bigger.
Well, she can try to stretch that opening, but the these are balloons that we use for treatment. This is called a contora.
Oh, contora.
Yeah, contora, and this is
another type of
radiation catheter, right? So these are all radiation treatment catheters.
Which one is better?
Well, it depends on what your size and the shape and the location. So there isn't one that's better.
This one looks like it's smaller.
Well, this one gets filled, though. Okay. This will get filled with fluid inside the breast. So it's actually bigger.
Okay.
It's about the same size as this once it's filled. This one takes about 35 cc's all the way up to, I want to say, 75 cc's. They used to make an even bigger balloon, but they don't make that anymore.
I have a question.
Yeah.
After the whole trimming is done, what happened with that space? It will close it up, or
your body does fill it with fluid. So there may be a pocket of fluid that just takes a long time. Like I see patients. In fact, one of them I saw today was 2 years from finishing treatment, and she still has a pocket of fluid, which is fine. We just know that it's there. It's called a seroma.
Seroma.
Yeah. So we don't worry about it. We just know it's there.
And it will be diagnosed properly when I have a mammogram.
Yes,
because it won't be like, oh, you have cancer again.
No.
Okay.
Yeah, so you'll get a mammogram like every 6 to 12 months. So you'll get follow up, and then ultrasounds as we need to.
And they say, oh, this is you have a
this is liquid in your breast. It's called a seroma. We know it's there. They follow it on ultrasound. So
so it doesn't get dried out like.
No, not generally. Usually after several years, it'll probably stop filling with fluid, and it will just slowly get, go away. Okay. Yeah, so.
Okay.
Yeah. Okay.
So for either one, we have to have
numbing medicine on your breast. It's called an envelope. Okay. And you probably had that for surgery as well. They might have had you put that white cream on to numb the skin. No.
No, actually, they asked me to do some antibacterial, soap.
Okay. Yeah, and we do that too. We have you do antibacterial soap the night before. And then we give you some Percocet or Nucynta, one of the pain medicines to take, and then a Valium that morning. And then we go ahead and, once you're here, we bring you to our room, we get you cleaned up, we have you changed to the gown, we will prep and drape the breast area. And then what I do is I'll pull the breast up together in a template, and then we put 3 localizing needles in, but we use some numbing medicine first.
Okay, yeah.
And then we numb the whole breast area as well. And then I'll put those 3 needles in, and then we drape you again. You're all covered up, so we do a quick scan through that part of your breast. And then with our physics staff, I can count how many other needles we need to put in, because we draw in the contour of the size of the volume, and we expand that volume a little bit, and then we have this total volume that we want to treat. And usually Erica or one of the other physicists is going to be doing that with me, and we know that we may need anywhere from 12 to 15 to 20 or however many it comes out to based on the calculations. And then I'll go ahead and numb those areas, and we go ahead and finish that. And then once we're done putting all those needles in, we replace it with the catheters. So then the catheters are there, and we trim it so that you're just going to have buttons on the skin. So at that point, though, you won't be able to shower until those catheters are out, and usually a couple days later. So we do the treatment. Now, unfortunately, you can't do the 3-day treatment because you're too young. Because there's a study looking at doing 3-day treatment instead of the 5-day treatment. So the 5-day treatment is twice a day for 10 treatments total. Okay, so you have to come morning and then afternoon, and takes maybe
so 10
20,
days.
Yeah. Well, no, 5 days,
5
but
days.
twice a day, not on weekends. So if you start Wednesday, you finish the following Tuesday. Okay. So, anyways, there's going to be a weekend in there somewhere. So, so we'll give you supplies to do the dressing change on the weekend. But every time you come in for daily treatment, they'll do your dressing change each time. Okay. Pretty much everything else you can do like you would normally, except for working out. We don't want you to weight lift or anything like that.
Is that painful or?
No, we give you pain medicine. We give you numbing medicine for the breast, and then so the first day you may want to take some pain medicine about 4 hours after the procedure's done, and then try to not do a lot of exercise or anything like that. Pretty much after you're all done with the treatments, then we'll see you the first week after finishing on a 1 week follow-up, and then we do another follow-up in a month. Okay, so that's pretty much how that works.
Okay, yeah, and then when I'm gonna have a testing, the cancer is completely out. The cancer is out.
Yeah, the cancer's out. So the oncotype is going to tell us a little bit more about whether so did you see Dr. Cato, or I can't remember?
No, not yet.
Okay. So that doctor or the medical oncologist is going to say, okay, yes, you need chemo, or no, we don't think that'll help you. And that's where that part comes in. Now, if you didn't do the multiple catheters and you said, okay, I would rather do whole breast, then we would have to wait for that chemo decision, because we know that we can give the whole breast radiation up to 6 months later. So it's safe and it works. Okay, so most patients, if they need chemo or are going to get it, they're going to get it before the whole breast irradiation. The brachytherapy of these short courses we do before chemotherapy. So
before anything.
Yeah.
Do